All right, I'd like to address Congresswoman Bean directly. Congresswoman Bean, my name is Stephen Titus, and I'm a teacher and a resident in your district without adequate health care coverage. I'm currently a part-time instructor at the College of Lake County and at Harper College, both in your district. And like many young, middle-aged, and older part-time instructors, not only are we paid half of what full-time instructors are for the same credit hours, but we are afforded absolutely no health benefits whatsoever. So I find that I have to actually fend for myself in an unchecked market. And I myself have already have a long and winding road of denial when it comes to health care. 4 years ago, I was rejected from Blue Cross and Blue Shield for having a sprained ankle. In the summer of 2008, I injured my leg when I was in a window without health insurance, and I found that out of fear of death, I had to get treatment. But after an hour of getting treatment in the hospital, I found that I had a $1,200 medical bill for 1 hour of treatment. Thankfully, though, I obtained coverage last year through Blue Cross, but unfortunately, as the tale goes, I found that I had to pay into the system for a full year, $100 a month, before I could get coverage for any of their umbrella window of previously existing conditions. And by the way, these conditions, as was explained to me, was, as they say, insurance crippling costs of exercise asthma and seasonal allergies, which I possessed, and they could never cover anything like that. Congresswoman Bean, I do not understand why you haven't spoken out on these atrocities in our nation. So many of us in your district, including myself, need your leadership on this reform. Now, as a teacher, I see countless 18 to 34-year-olds in my classrooms with mounting educational loans and a frenetic life of work and school that go without regular checkups at the doctor, or even go without having insurance because they fear that costs will bankrupt them, much like it has for the 2/3 of people who declare bankruptcy because of medical bills. Saying the young are healthy and don't need insurance fails to include all the out-of-pocket expenses that we have to pay, or the fact that, by God, that we won't get a serious disease tomorrow and don't have any coverage to pay for it. What is going to happen for us? President Obama was right when he said that it is shameful that this occurs in this nation where profits are leeching upon human pain and people are left to suffer in a monopolized, unregulated market. Congresswoman Bean, I need your vote on H.R. 3200.
Yes. Yes.
It is statistically across the board the strongest healthcare reform plan with a government public health insurance option that will assure everyone, including those 18 to 34-year-olds and teachers like myself, will receive coverage. It pains me deeply when I cannot help my students. I just found out last week that one of my former students had to drop out of school because he has to care for his own medical bills, care for his mother with stage 1 breast cancer, and has to work 60 hours a week, drop out of school so that he can go ahead and actually make the family live one more year before declaring bankruptcy. For his sake and my own, I really hope that this year we leave the devil out of the details. Now, speaking of the devil in the details, I know that there has been a lot of talk about a level playing field, but in all honesty, folks, when has the insurance industry ever played a level playing field?
Never.
See, a true level playing field gives individuals and small businesses the chance to have affordable coverage long denied to us. A true level playing field allows a public option with rates comparable to Medicare, plus 5%, to get a jump start on offering competition and then insurance. A true level playing field, doesn't make us lose out on $85 billion over 10 years in budget savings because we chose the weakest possible public plan available. Congresswoman Bean, in closing, as a district resident, as a healthcare reform leader, and as a teacher within the 18 to 34-year-old bracket, I really desperately need your vote on H.R. 3200. We all need a healthy shot at a fair and balanced life in America. Thank you very much.
Yeah.